I'm India Ornelas, professor in the Department of Health Systems and Population Health here at the University of Washington. And I'm here today with my friend and colleague, Paul Fleming, who is an associate professor in health behavior and health equity at the University of Michigan School of Public Health. And today we're here to talk about his new book, Imagine Doing Better: Why Policies Backfire and How Prevention Thinking Can Change Everything. And the goal of this book is to provide a hopeful roadmap to a future where all communities have the resources and opportunities to thrive. Thanks for coming, Paul.
Yeah, great to be here.
So let's just start by having you tell us a little bit about how you got into public health as a career. What drew you to it?
Yeah, I got started in public health a little bit later than some people. When I was an undergraduate, I had no idea what public health was. But I was the child of a teacher and an engineer. And so I always think about that kind of upbringing as there was a desire to kind of give back to the community and solve challenging problems. And so that's what partially motivated me to join the Peace Corps after undergrad. And that's where I learned what public health was. I worked as a community health worker in partnership with a local clinic and really did kind of health promotion activities, got to learn what community-based public health was. And what I really loved about that was that we needed to kind of lead with relationships and trust building, and that really has served as a foundation in my work today in public health.
And what motivated you to write the book? Who were you writing this book for?
Yeah, I mean, the dedication for the book is to my children and all children, because I think, so much of what I think about in my work is like, how are we leaving a better world behind to future generations? And the more work I did in public health, the more I thought about how so much of the things that we talk about, I know you talk about in your work, related to how we prevent harms before they happen, bringing an equity lens to the work we do, drawing on principles of community organizing to make change and policy change. It really felt like those were important things that weren't necessarily part of the national discussion when we were talking about policy making. So a lot of times policies were made in the absence of any sort of perspective related to prevention, related to equity, things like that. So I felt like there was a real opportunity to bring some of the things that we talk about a lot in public health to a broader audience, and particularly focused on how we make policies, how we allocate budgets, and how do we build towards a better world. So the more those ideas started to come together in my head, I started to think about, what role can I play to sort of bring some of that to a broader audience? And I thought of a book. I love writing. As an academic, we have the chance to write journal articles, sometimes op-eds and things like that. I also really kind of liked the challenge of trying to tackle writing a book. So all those things came together, and it felt like it was not the opportune moment for me, but yet I still felt called to it. And I kind of just started writing, even though my rational brain said, this is not the right time to start writing a book.
You use a lot of stories about different people that you've encountered in your life or different events, and those often kind of anchor the chapters in the book. Tell us a little bit about why you chose to use that storytelling approach.
One of the first chapters that I wrote in the book, I ended up sharing it with my sister, who does not work in public health at all. And I wanted her feedback because I knew kind of what public health folks might think. And my sister was like, oh, so you're writing a textbook. And that sort of hit me negatively, because I was like, I'm not writing a textbook. I'm writing for a general audience. And so that really made me kind of think about, what is it that I like in certain stories that or books that I'm reading? And I realized that it's the storytelling, right? That's how we connect with people. And so it really just made me kind of think, what stories do I have? What stories connect to some of these ideas?
Yeah, I love that. I think storytelling is a really powerful form of narrative that helps people put themselves in the situation a little bit more than a textbook, for example. And so it's something that I'm trying to do more in my own presentations too, even to academic audiences, to really help them feel the emotion too, right? Help them understand what we're trying to communicate on like more of a gut or a heart level, not just from our brains, as we tend to stay up here as academics. So I loved that. I loved the stories that you told. Did you? I kept wondering as I was reading it. Do you journal, or how did you
Mhm.
remember these stories? Did you have to go back and kind of dig through your own memory banks?
So I mean, I have journaled at different points in my life, so I did look back to them to some extent. But I also think I talked with people. I was trying to, recall stories. And I think generally I have a pretty good memory. So I can't promise you that all my recollections from decades ago are exactly how it happened. But I think, I wanted to put myself in the place of like what happened and who were the important players and how did it play out.
Yeah, yeah. So one of the stories that you mentioned in the book is about a woman named Shiomara. I think someone maybe you met while you were doing Peace Corps that called you a Yankee imperialista. And maybe you can share a little bit more about her story and the story that you share in the book about her perspective on the U.S. healthcare system and how that differs from the health system in Nicaragua.
Yeah, definitely. Siamar is somebody who, was a dear friend, still is. And I worked closely, so I was assigned to work with her, but then, a friendship really developed. And, she's somebody who grew up in Nicaragua under a dictatorship and was, as a young woman, really part of the revolution that helped topple that dictatorship. A couple decades later, here shows up this guy from the U.S. to come work. And if you know Nicaraguan history at all, the U.S. kind of backed the other side. So Xiomara and the revolutionaries, took over, and they were trying to foster a government based on education and housing and healthcare for all. And the U.S. Really kind of backed the other side, and there was a civil war there. And so, a lot of those feelings linger, attitudes or thoughts about the U.S. as this sort of superpower that really meddles in other countries. And so she always called me this Yankee imperialista, which, I thought was both funny, but also, really reflected who she was showing up for her community as. She had a healthy view or a healthy bit of skepticism. And as we were talking about health and healthcare, she would just always ask me the questions about the U.S. healthcare system, like, how could you trust a doctor that ultimately makes more money if you're more sick? Because the way the healthcare system in Nicaragua was set up is you didn't have insurance, you didn't have insurance cards, you just showed up at the clinic. Now, of course, there were limited resources, and they didn't have all the ways to treat illness that we might have here in the U.S., but they started from this fundamental place that health is a human right. So we're not going to turn anyone away because they can't afford it. And certainly their doctors are not making more money if their patients are more sick. And so that really was part of shifting my own mindset to really think about the systems we do have in the US. Because prior to that, growing up, I was on my parents' health insurance and got healthcare access. I was privileged in that way. And so it really started to shift my perspective on how our systems really shape kind of who gets access, who doesn't, who can thrive in a community, who doesn't. And then, thinking about healthcare as a human right, when we do that in a society, what kind of health does that enable when we just kind of, it's not a question. And so I think that's a piece that Xiomara really taught me just through conversation and getting to know her and her perspectives better.
Mm-hmm. So one of the approaches that you suggest is to plan for and make policies that will benefit several generations ahead of us. This is a practice that you talk about that's been used by many in indigenous communities, thinking, 7 generations ahead. Definitely in my own work in health equity, I think a lot about the impact that I'm going to be able to make in my lifetime. And I think we've seen, you talk about sort of some of the faults of this incremental change that we do. We do small tweaks to programs and policies over time. But I think even with those small tweaks, we do see, forward progress. And so I have my own hopes of what I hope to see in my lifetime working with the communities that I work with, sort of slow, but progress. And I think right now it's been especially hard because I see so much of that backsliding, right?
Mhm.
With so much less investment in health equity, less investment in vulnerable communities, communities of color, now I'm worried that I won't even see some of that change in my lifetime. And it is forcing me to think, the way that you are speaking about that, like, I might not see this change in my lifetime, and I actually have to do this work for generations ahead of me, whether I see it or not. But it's hard. It's hard to stay motivated to make those changes. So I'm just curious, sort of like, how do you stay motivated, knowing that the work you're doing now you may not see that change for in your lifetime.
Yeah, I mean, I think it's that tension where, on the one hand, when we think generationally, it can allow us to say like, okay, well, I don't have to solve everything right now. But I'm just trying to push things forward. And that can be helpful, but it also, like you said, it can feel a bit frustrating because, we are doing this work with the hope that we can actually see we can see changes, we can see people benefiting, and we can actually see communities thriving. And we are in a particular moment right now where there is backsliding. We are seeing systems, even if they were extremely imperfect to begin with, and in fact, sometimes harmful, but now they're being eliminated, and that's an even worse situation. And so I think it is a really, really tricky thing. There's a musician, Brett Dennen, who sings, I'm planting trees I'll never climb. Mm. And, I think about that as sort of reframing what it is we're doing, which is, what we're trying to do is build that better future. And even if we're not going to be able to benefit from it, then we are at least helping the next generation be in a better spot. Just like you and I benefit from some of the ways that previous generations sacrificed to make our future better. And so I think when we put it in this generational perspective, I think about, labor protections. Generations ago, there were people that were activists, union organizers, and other things that organized to sort of make things look the way they do now. The abolition of slavery, right? There was people that organized to make that happen. And so I think about what is it which movements are we going to contribute to, that hopefully we will see them be successful in our lifetimes. But all of those other movements sometimes took generations to actually be successful. And so we don't actually know which point we're at. We might be at the beginning of certain movements, we might be in the middle, we might be towards the end. But what's most important is that we kind of keep planting seeds. We keep doing the work to move it forward. And I think that's what brings me some hope, is just knowing that if we keep moving things forward, we eventually will get there, even if we don't know when.
Yeah, I like that. And I like the idea of sort of thinking about what our ancestors did to get us here, and that, like, in many ways, in many rooms, I've been a first Latina to be, faculty person, or to get tenure, or to be, chair of a department. And what are all the things that people had to do before me to get me to be here? And so I think, that's something that motivates me, is sort of thinking about the contributions that generations before me made so that I could be here, and sort of how we then also pay it forward. So related to that, I think your book really encourages us to dream bigger and break free from some of the constraints that maybe were imposed on us by previous generations. Maybe, some previous generations weren't as forward thinking as they could have been, as you point out in some of the policies that you discuss. Do you have dreams for your own work or the communities that you work with? What are some of the dreams that you hope will come true, whether that's in your lifetime or, a couple generations from now?
Yeah, such a big question. And I think so important that we all wrestle with that and reckon with it. It's pretty infrequent that we actually allow ourselves to dream in that big way. And that's part of what I invite folks to do in the book, is actually think about what does that future look like. And so I think for me, one of the things when I dream about the future is, I think about this relationship and kind of communal aspect to the future. So, in present day, I think there's a lot of ways in which we as individuals are disconnected from one another, and our communities we're quite disconnected in some ways. And so when I think about that future, it is, thinking about communities first and thinking about what are things we can put in place to have communities thrive, not necessarily individual first. What can I do so that I can enrich myself? What can I do so that my kids will be successful? But really that orientation shifts to what can we do so that we all can be successful? So I think that looks it's going to look different in different communities, but for me, it means that we are coming together in different ways. When we think about education for our children, it's an all hands on deck type thing. It's not something that we just heap all these tasks on our teachers and then it's done. But it's neighbors volunteering in schools, it's grandparents, participating in some of the teaching, things like that. And so that's part of where I dream about, and I write about it a little bit as the very final chapter of the book of here's what a world could look like in 200 years. And ultimately, I think that's what I hope we all do is actually write out in specifics what that world looks like, and then identify, well, if that's where we want to be, what are the things I can do in the next day, week, month, year to start building towards that. Is that something you do? Do you ever kind of really dream and envision that future?
I do, but I think not enough. And I think I did leave, reading the book thinking that that's something that I need to do more. And I think especially now where it feels like so many things are getting taken away from us, or we're being asked to cut things here and there, we have to keep dreaming, and we have to keep imagining what it could be, maybe especially in times like this. And so it's definitely something that I want to incorporate into the work that I do with communities too, because I think it's important for them to keep dreaming for a bigger future for themselves and what could be possible. And I love that collectivistic orientation. That's what drew me to public health originally, was this whole idea that we could maybe don't have to focus as much on what's good for each individual, but what's good for all of us together, and that we are actually stronger together, and we can go further as a society, as a community, when we look out for everybody.
Yeah, I love that. And that's such a great point, that public health does exactly that. It's about the public, not the individual. And that's, ultimately kind of what I think the book brings to the table, is these public health ideas is something that we actually can build a better society if we sort of build it on this collectivist prevention thinking, other things like that.
Yeah. Well, thank you so much for this conversation today and for writing this book. I'm really excited for the many conversations that I think it will stir up in our field.
Thank you.